of GSK for a panel discussion on innovative solutions for equitable and sustainable antibiotic access.
Hello again. As I mentioned in the previous segment, which you were all watching both in person and online, I can hardly think of a more important and timely issue to be discussing than AMR, especially as we're here on the eve of the high-level meeting that's taking place. And we're really fortunate to have such a distinguished set of panelists representing industry, science, civil society here, and multilateral institutions as well. We're going to dive right in, and there's a lot we want to cover. And Manica, if you don't mind, I'm going to start with you and ask you a question that might, for some people, seem counterintuitive, but is actually really important, which is we hear so much about the overuse, oversubscription of antibiotics and how that can be a driver of AMR. But GARDP is trying to expand access to them. Why? Explain why that's important and what role preventative measures have when we talk about, advancing the challenge of AMR.
So thank you very much. Just thank you all for coming here today. Just to introduce myself, I'm the Executive Director of GARDP, but my background really is as an emergency physician. And over the course of my career, I've been very lucky to work in very different aspects, ranging from clinical care to drug development, working in public-private partnerships. But a major driver for me has always been about access, and I think we need to see access as really a fundamental dimension of giving healthcare, whether it's access to healthcare, access to essential health tools, etc. And I think it shouldn't be any different when we talk about antimicrobial resistance. We don't see in our organization stewardship and access as conflicting issues. We see them as integrated issues. You can't really think about stewardship without access, and you can't really think about access without how you want to use these drugs responsibly. It's worth remembering that we've seen with all the data that's come out recently that this is a growing problem. We have millions of deaths, whether they're direct or attributable, related to AMR. This is going to be increasing by 2050. But one of the striking figures that came out from the Lancet study of last week was that you can look at 50 million deaths being averted by improving access to antibiotics. And that's a remarkable figure, because that's the low-hanging fruit we have to think about. For us, we have to think about improving access to old, established antibiotics that are also on the essential medicines list. But we are dealing with a very dynamic field. Bugs evolve and change. Who knows what's going to be happening over the next 25 years? And we need to ensure that we also replenish the pipeline. And this is where the R&D dimension also becomes important. So I hope that's answered the question.
Yeah, no, it's great, and it's a great place to start, and I think gives us a lot to build on. And you talked a little bit about R&D, and closely related to that is, of course, data to inform the science and data to inform the policy decisions. And Soumya, I'd love to go to you next and ask you specifically about this, which is, how does the lack of reliable data to inform policy decisions affect the ability to combat AMR, and what steps should multilateral institutions and their partners be taking in order to improve the quality and availability of AMR data globally?
Thank you. So obviously without good data, it's really very difficult to make policy at any level, global or national or subnational levels. And so I think there are many aspects to AMR data. And of course, the WHO has the GLASS database, which is basically countries depositing data on antimicrobial resistance, especially from a set of priority pathogens. Now, this is mostly a tertiary hospital type of data. It's still patchy, and it's not representative. So it reflects the extreme, patients who are hospitalized and may have a lot of nosocomial infections and so on. So clearly we need much more data. We need data from the community as to what the prevalence of resistance, because that's when the treatment guidelines will have to change, because depending on what kind of resistance you're seeing in the population, obviously then you would recommend different antibiotics to be used. And I agree with what Manica was saying, that in large parts of the world, it's lack of access to antibiotics that's killing people. And in the future, of course, it's projected that more and more people will die because the antibiotics are not working anymore. But even the ones we have are not being effectively used. So I think broader data also from environmental surveillance, and this is something now we've seen during COVID, and also has been used for polio for a long time, but now there's a much greater availability of genomic labs, of sequencing facilities. These were all set up during COVID. We should be using those now to collect more data on very specific on the mutations, and in fact that might be an easier, more rapid, maybe even more cost-effective way, since the infrastructure is in place to collect data. And then finally, we need data also from agriculture, fisheries, veterinary, and so on, because we know that this is all interconnected, and that's when we talk about the One Health. And so I think a very practical application of One Health is with AMR, where at the country level there must be a good way of sharing data between these different silos and sectors, and that will help policy making, because in India, I remember we were able to regulate the use of certain antibiotics for animals based on this type of data sharing.
I think that's such an important point, and over the course of today's discussions, this issue of siloing has come up, and I love how you put that, because it's such a practical way of understanding the interventions can't possibly be targeted if you're not really understanding the connections between those sectors and data that is collected across them to inform strategy making. Dame Emma, it's great to have you with us, and I want to talk to you a little bit about the role of the private sector when it comes to addressing the AMR challenge, and picking up on the threads that we've just heard a little bit about. And so, there are a multitude of challenges related to AMR that the pharmaceutical industry has a role in addressing. Everything from the environment to availability of medicines to preventing the overuse of antibiotics. So, from your perspective, can you share some specific initiatives that GSK is implementing when it comes to trying to address these various challenges, and to do so in a way that's both holistic but also specific to the challenge?
Yeah, of course. I mean, first of all, I would say it's wonderful to be here on this globally critical topic, the eve of some very important discussions tomorrow, and I could not agree more with my colleagues' comments today that the access challenge is multifaceted, and too often is shorthanded for industry as being a question only of affordable pricing, and it's very, very far from that. Of course, it has to be sustainable pricing, but it's really multifaceted and integrated with stewardship and innovation as well. For us, these are the questions to engage in are innovation, first of all, continuing to fund a pipeline of new, needed, effective antibiotics, prevention, and that is about, frankly, preventing some of these diseases before they even start, including with the deployment of vaccines, which are one of our greatest possible tools against AMR. Of course, the variety of aspects of stewardship that we all know, and that is so complex in limiting innovation for the sector because of the incentives that are seen not to be in place. Multi-dimensional challenges of access, including education, and obviously the right diagnostics, so the right antibiotics are being used with the right kind of compliance with their usage. And all of these things need to work together, which is exactly why we want to work across all of them. We start by leading with our science. We are a global leader in infectious diseases, and I'm incredibly proud that at GSK we do continue to invest, building on 70 years of experience, very strongly in one of the largest AMR relevant pipelines in the industry. We've got more than 30 projects, in fact, across medicines and vaccines, and 13 of them facing into WHO prioritised pathogens. And because we know we have to keep accelerating progress, and that's also put us in a position to be number one in the AMR benchmarks innovation category as well, but we've also engaged with multiple partnerships, whether that be our funding of the Fleming Initiative or indeed the very exciting new engagement with GARDP as well, because we do believe that innovation comes in partnership, and it's about, you know, maximising our usage of the latest technology to advance our chances of success here.
Sure, yeah, and just to pick up on a couple of the things that you said, and these are all just such important elements of the whole picture. And, you know, as I'm listening to you speak, much of what you said also builds on what Nora was talking about in the previous segment. But one piece that is key is the mobilization of resources, and I want to touch on this a little bit. And Manica, just to come back to you, you know, funding is a perennial challenge, you know, and we understand that in order for this to work, there's going to have to be innovative financing as part of the solution. So tell us a little bit about, you know, what are those funding models and innovative financing mechanisms that you think could sustainably support the development of and distribution of new antibiotics, exactly of the kind that Dame Emma was touching on?
Yeah, I'm not a policy guy, so I'm not going to pretend to kind of wax lyrical about this, but I would say that you need to see this more as an investment rather than just funding. I mean, the implication of saying we need push and pull funding is not untrue, it's true, but when you put it that way, it looks like a burden. And I do think that this is a fantastic investment in our future on multiple different levels. That would take me too long to explain. I think it's important that people understand that obviously people know that R&D is a risky and expensive business. But from our perspective as a public-private partnership, we have to interface with many different types of actors. For instance, we work with small biotech companies, as an example, who are often, you know, the spearhead of innovation. We work with mid and large-sized companies with different types of partnerships, including around access. And of course, you know, Emma's mentioned, you know, the recent partnership with GSK. But just to shout out, we also have an access partnership with Shionogi as well, which is an extremely challenging and very interesting project we're working together with. But we are also working with other companies that are more involved in manufacturing and supply and distribution. And you have to be thinking about how are these companies going to be staying in the game in order to not just do the research and development, but also ensures a long-term, sustainable, quality-assured supply of these antibiotics, and ensuring also that they are affordable. So this is a big challenge, and this is why people have started talking about the need to have these innovative financing mechanisms and push-pull mechanisms. I'm obviously conflicted when I say that this isn't enough. I won't pretend I'm not, but it isn't, because this, as I mentioned before, this is something that we have to see as a long term. We're working in a very dynamic field. These bugs are mutating faster and on a very different dimension to how we live our lives. I think that's part of the challenge, and we just don't appreciate that difference between the bacteria and us. And I think that's also another reason why we have to think about this differently, that dynamic, very dynamic element, which means that it's a long-term but constant innovation. You're not going to get solutions that, you know, magic bullets that will fix the problem indefinitely. So I think this is something that we just have to accept and think about in the long term. I will finish by saying that we also then have to invest in access, and obviously looking at access in a responsible way. But this is where in the past I think we've often missed that part of the equation. And I've looked at it in my own experience of how we've introduced antibiotics in different parts of the world in my career in the last 25 years, and also scenarios where we never did introduce those antibiotics. And I think we have to solve those two different challenges.
Well, and speaking of those multifaceted challenges, a couple of the things that you touched on build directly off of what Dame Emma was talking about. So I want to go back to you for a minute, and especially as relates to sustainability. As you said, GSK has been around for a very long time, and you all have been doing this for a very long time, but also the role of partnerships. You can't do it alone. So tell us a little bit about how those two pieces come together in terms of your work on AMR.
Well, as I said, you know, if you're thinking about the question of access, That's certainly not something we can do alone. By the way, we say the purpose of our company is to combine science, tech and talent to get ahead of disease, including AMR, together. It starts with prevention. So that means vaccines, and we have huge programs of partnership with Gavi, for example, the Vaccines Alliance, to increase access to vaccines. And we've been doing that for over 2 decades, and the right kind of stewardship. We talk about robust surveillance and the sort of data that we need to have, and we have a big program in India at the moment to be able to look at the infection index, which we're then able to partner with healthcare professionals to give them visibility at a truly local level in terms of the susceptibility to different antibiotics, and offer a service to them. It's also deeply about distribution on the ground and in the front line. I was just on a visit to Kenya very recently and was talking to Kelvin, who was a young expert in a community centre in Mukuru, and he was extremely clear that on the subject of supply, reliable supply, there's a big difference between how you secure reliable supply for the new innovations, starting with, are they registered? Do you get the kind of demand, even at the beginning that can be low demand, and how do you get the right kind of diagnostics around a brand new antibiotic? But even when you start with generic antibiotics, there's often a real issue with demand forecasting that can then lead to stockouts that then drives inappropriate use. And you still get 10% or so of antibiotics that are frankly counterfeit. So there's a whole variety of different ways where we have to, partner in the front line and very locally, because you have different challenges in different countries, particularly across the global south.
Yeah, and picking up on that last point, and I know we're almost out of time, but I want to ask one last question, and would love to hear from all of you on it very quickly, but starting with you, which is that, as we're here on the eve of the high-level meeting tomorrow, what would you like to see in terms of specific commitments from world leaders to turn goals into actionable steps? And what are the strategic shifts that are needed, having, in your experience, Soumya, worked in such difficult and diverse settings where this challenge is already a lived reality?
So I think if we all recognize that antimicrobial resistance is a huge problem now, and even bigger one for the future. And in fact, from the science perspective, we know what we need to do. We have to work on developing new antibiotics and vaccines for sure. But even currently, we're not doing the things that we are supposed to be doing. So for example, it would be great to see commitments on the agriculture side, for example, to reduce the use of, or eliminate the use of antibiotics as prophylactics. There's enough evidence that helps to spread AMR in humans. You'd like to see commitments, from different sectors around also training, capacity building of healthcare workers, improving supply chains, and the things that Dame Emma was talking about. And then finally, I think the world can come together. Governments invested huge amounts during COVID to rapidly develop vaccines, and it was possible to do. So I think with the current state of science and technology globally today, if private-public partnerships happen and governments invest, then I think things do happen. So I would hope that they pick up something like TB, for example, which needs to be solved. And I know that GSK is working both on vaccines and treatments for new drugs for TB, and say we can solve TB. Why should 1.5 million people be dying of TB? And it's not drug-resistant TB, just normal TB. Why, in this day and age, should we accept that? And if we can come together and solve that problem, it's a very good way and a huge motivating factor for us to say we can do this for other bugs as well.
Yeah, I really appreciate both your sense of urgency, but that optimistic tone. So in the last final seconds, Manica and then Dame Emma, anything you want to add in terms of that final call to action with the meeting happening tomorrow?
I don't think I've got anything to add. I just want to see something concrete happen. I mean, at the end of the day, governments are responsible for their countries. They have to prioritize this. They need to finance their national action plans. But it does help if they work together. And I know it's not a fashionable thing to say anymore, but the solidarity really does matter. It just saves everyone so much more time and effort.
Nearly 40 million people are going to die by 2050 unless we wake up and do something about this. It is extremely serious. It is a real and present danger, and we have an opportunity, and I want to be optimistic like others tomorrow. We're looking for three things. First of all, that we do incentivize R&D and innovation, because at the moment resistance is outpacing R&D. And that does mean some new policies, pull policies that governments should introduce, not only to stimulate investment, including in biotech, but also critically avoid perverse incentives for over-prescription. Secondly, we've got to recognise the value of vaccines and stop the misinformation that is rapidly accelerating, frankly, even in theory, the richest countries in the world, and that is a serious, serious problem, because there is no greater return on investment than stopping disease before it starts. And lastly, it is an agenda that we need to work on together, whether that's across countries, across civil society, across academia, and also I'm really pleased to see the recognition of the private sector in this, because we do have a role to play, and we're extremely committed, including to catalyse that impact tomorrow, so that we can get ahead of AMR together.
Well, thank you to Manica, Soumya, and Dame Emma. I know that each of you are involved in these negotiations and discussions, and I hope that it goes well and that we can see the kinds of results and change that you've all, emphasized is really needed for saving people's lives and having a healthier planet. So thank you for all that you're doing.
Thank you.